All right. Okay, well, welcome everybody. I'm Dr. Rebecca Taylor. I'm the owner of Green City Dental, and we are in Edmonds, Washington. Been here about 11 years, and I'm just excited to start this. We've been talking about doing a webinar for a long time, and Isabel has, the Dr. Isabel, she's been awesome at pushing me to like, let's do this, and just really want to open up the conversation about biological dentistry to the public and just give more information. A lot of our patients come in and have their new patient exam and they leave with their head spinning a little bit because we talk about so many things. The mouth and the rest of the body are so connected together. And it's even overwhelming, I think, sometimes for us doctors to kind of help put all of the pieces together. But I think that's something that we really pride ourselves at a Green City Dental is really being able to offer that really comprehensive care where we're not just looking at teeth, we're looking at really whole body health, and we're also looking at how we can, signs in the mouth of potential other systemic issues that could be going on and helping guide patients so that they can get to the right resources. And really, ultimately, my goal is to teach you how to be your own advocate, for your health, because sometimes doctors they're busy, they only have a few minutes with you, um, and my own experience, my own health journeys have really taught me that it's so, so important to be your own health advocate. And in order to be your own health advocate, you have to have good people on your team. And I feel like at Green City Dental, we really love being part of that team with you and being able to communicate with your other practitioners to really offer that full comprehensive care. So thank all of you guys for coming tonight. I know it's late on a Thursday and it's beautiful outside and there's lots of Easter eggs that need to be hid. But that's what I'm doing when I go home. But anyways, I'm very glad that you guys showed up and we want this to be very conversational. So, we don't have a presentation to share with you. If we need help, we can definitely talk. Doctors and I love talking about all things related to health and dentistry. But really this is a platform for you to come with your questions. If you want to learn more about something or there's a topic that you want to deep dive into, this is what this hour is all about. So welcome.
Yes, and one of the things that we have noticed a lot is that our patients go to multiple doctors, multiple dentists, and they get multiple answers to what's going on, or they don't get answers to what's going on in their mouth. So I decided I've been a dentist for almost 27 years now, and probably Dr. Taylor was
Wasn't
learning
even
to
born yet.
walk.
No, I'm just kidding. I was
So
definitely born, but
so being dentist, but when I realized that what I was doing as a conventional dentist was not enough for my patients and I was not helping them with all the things that they were experiencing, I decided this is not correct and I need to do something different. And I met Dr. Taylor because she is a friend of a chiropractor that we refer patients to. And I met him and he said, you need to meet. So I decided, okay, we met. And at that time, I was already starting to do a lot of things that were more holistic, but not fully with dentistry. And I decided, no, this is what I'm going to do. I cannot be practicing conventional dentistry anymore. I need to do biological holistic approach. And that's when I decided to join Green City Dental and Dr. Taylor and follow her path and learn from her experience and her wisdom. And that's what we are trying to do, trying to share what we have learned through all the different schooling, the extra classes. And Dr. Taylor she's really good at going to extra classes and going to the next level.
yeah.
So that's what we're doing here. So if you guys have questions, we will appreciate if you type it in the chat, or if you want to open your mic, you can also do that. Because this is what we want. We want it to be an interactive Q&A. We just don't want us just talking the whole time. we can do that, as Dr. Taylor said, and we're really good at that, especially with our patients have their mouth open and they cannot talk. But now you guys can talk. So we want to hear you and we want to see if you have any questions. If not, we have some questions also that we have received from other people. But I want to open the chat, and if you want, or if you want to open your mic and ask, that will be great.
So whenever someone asks, like, what's the difference between what a biological dentist does and what a general dentist would do, I always come back with, in a biological office, we are really looking at what is the root cause of the problem that is in front of us. So if you have a cavity, for example, we're going to ask ourselves, okay, there's a cavity. I know my dental brain in dental school, I was taught drill out the cavity and you put a filling in there and the patient's on their way, right? There's not really a lot of talk about, well, why did that happen in the first place? Why did that cavity happen in the first place? In dental school, they teach a little bit of basic types of things. They say, oh, it's bacteria and it's acid and all that, but nobody really talks about, like, well, why is this part of the body breaking down? Our teeth are little mini organs. And so why is that part of our body breaking down, right? We can see our teeth. So a lot of time we can see our gums, we can see our teeth, but we can't see inside of our body, right?
Right.
And so when we see signs of disease in the mouth, like cavities or periodontal disease, or we see wear on the teeth, we see fractures on the teeth, anything like that, we're going to think, okay, how did this happen in the first place? And let's focus. We can fix the problem. We can do that filling. We can put a crown on the tooth. We can fix the issue. But what caused this? Because we got to treat that too, right?
Right.
So if somebody comes in with a lot of decay, I'm always thinking, all right, there's something going on with the pH. There's something going on with mineral absorption into the tooth. There's something going on maybe with fat-soluble vitamins, and there might be something going on with digestion, because this is all one tube, right? And we look at the microbiome too in the mouth, just like the gut, right? It's all one tube, right? The microbiome actually, it's the nose, then the mouth, then the digestive system, right? So all one tube. And a lot of times we see disease in the mouth that's actually a sign that there could be dysbiosis somewhere else in that system. So we're looking at, we're, like I said, we're the technicians, we can fill that hole. We can put a filling in, but we're always going to be asking the why. And I think, I know that that's very unique to our practice, especially because Dr. Isabel and I are very passionate about that. I think the word biological dentistry sometimes is waved around as kind of a marketing type of thing, right? So it's not always like, we get patients every day that are like, I've been to so many other biological dentists and nobody's like really gone this deep with me. And I think that, so we have a whole podcast actually that's on what to ask when you're shopping around for a biological dentist to really make sure that they are going that deep with you. So, and this is why we're doing this webinar, because it goes really deep, once you start peeling back that onion, it gets deeper and deeper and deeper. So, yeah.
Yeah, and
Thank you.
it is incredible because unfortunately, I saw a classmate actually the other day, and she was posting some information on Instagram, and she said, well, I tell my patients that they have inflammation in their gums because they have a lot of bacteria and that they're not brushing correctly. And a lot of people, a lot of dentists think that that's the reason. But as Dr. Taylor mentioned, there's more reasons behind what's going on in the body than just bacteria. Yes, it's a big part of it, but we see a lot of patients that they have an immaculate oral hygiene and they're still having problems with their teeth. They're still having inflammation in their gums. So then why is it that these patients that are having a really good oral hygiene are coming with inflammation or with decay? Or why is it that a kid that is having really good oral hygiene is coming with 10 cavities at a time? Very good oral hygiene, and she had at least 10 new cavities, and she comes every 6 months. But then she has digestive issues. She has leaky gut. She has a lot of problems with her digestive system, and it's showing on her teeth, unfortunately.
Yeah. And a lot of times people don't even know that they have gut issues until they come to our office. And then we say, this is not normal, right? It might be common, cavities are very
Right.
common, but they're not normal. And same with gum disease, it's very common, but it's not normal. And if we just go, oh yeah, I get cavities, my mom got cavities, my grandma got cavities, I have cavities, we kind of normalize it. But there's a
Yes.
reason why we're getting cavities. There's a reason why we're getting disease in the mouth. And it's much deeper than, anything that you're putting on your teeth, right? Like a lot of people ask us, like, what's your favorite toothpaste that you use? And I'm like, well, I don't care if you use a toothpaste or not. Like, why do we use toothpaste? What does it do, right? It really doesn't do anything. It's actually better to mechanically, remove all of the plaque. Like, so to me, like, it's also like, what are you trying to get out of your toothpaste? Like, right? So whatever you present with is going to help me determine what kind of toothpaste you should use. But to be honest, I don't really, like toothpaste to me is kind of optional.
So if you're having demineralization, if your enamel, your tooth structure is not strong, you want to help that enamel to get stronger, right? Isn't that so? Then you're not going to go and get any kind of toothpaste because, as Dr. Taylor said, there is what removes plaque is that action, that mechanical action with your toothbrush, not really the toothpaste. So then you have to use what is going to be beneficial for you, not just, oh, I saw this in the market and this is what all the dentists are recommending, but it is not what is necessary for you. It's not what your body needs.
Right.
It's not for like every patient you're going to get the same treatment plan or the same information. Is because it's very individualized.
Yeah. Yeah, and another example is, x-rays. Like a lot of times at a dental office that you would go to that takes insurance, they're going to take x-rays on you every 6 months. And it doesn't matter if you've never had a cavity before in your life, you're going to get an x-ray every 6 months. That is not actually standard of care. The American Dental Association says that you should take x-rays when necessary. And so, but if you're going to a dentist that's really insurance driven, guess how often they will pay for x-rays? Every 6 months,
Right.
right? So you're going to get the
Yeah.
x-rays every 6 months, okay? But in our office, we're like, do you need them? Have you had a cavity? Do we see a problem? Is it necessary? Is it medically necessary, right? If it's medically necessary, we're going to recommend it. If it's not medically necessary, we don't do it. And so that's another really big piece about all of this. We get a lot of questions on the phone about, well, do you take insurance? And, I would love to take insurance, but I don't want to be put in the box of playing the insurance game because I really do feel like if you go to a dentist that's very insurance driven, they have to find so many things wrong with your teeth, so many things, right? To make them their bottom line because they're giving a discount on the dentistry, right? So they have to do more dentistry in an hour than we have to do in an hour. And they have to take x-rays every 6 months and they got to put the fluoride on your teeth because you get $30 extra to do that every time, right? They're doing all these add-on things. And I've seen several patients that come in with these treatment plans of teeth that have, they've got 20 cavities. And I'm looking at their x-rays and I'm like, I see 3. And if I kind of squint, I can see tiny little spots, but we can remineralize those. We don't have to drill in those teeth, right? And once you drill in a tooth, you're married to the dentist for life because the average filling lasts 7 to 10 years. So every time
Oh,
you have a filling replaced, it gets bigger and bigger and bigger, right? So there's a lot of kids that do sealants on their molars. And I just had a patient today. She's like, should we do the sealants? The other dentist is telling us to do it. And I'm like, well, eventually that sealant is going to fail and you're going to need a filling. So you've just set that tooth up for needing dentistry for life. right? And this isn't like a 10-year-old kid, right? You're marrying them to the dentist. So I do feel like when we're not insurance driven, when we can make the decisions and we can say, this is what the patient needs, this is what's best for the tooth, it really allows us the freedom to do that. And I think in the long run, you actually save money because I've seen way too many people come in with treatment plans from insurance driven offices that are way overtreated, so much overtreatment. And if you think about like the whole lifespan of your tooth, that's, how long are we going to live till, right? And if you have to replace that dentistry every 7 to 10 years, that's a lot of dentistry, you know?
Yeah.
A lot of dentistry. And insurances are not going to cover a crown on every single one of your teeth, right? So at some point, you're going to reach your maximum with your insurance where they're going to say, we're not covering any of that. And now you've got to pay for a lot of extra dentistry, right?
Yeah.
So I think that question, a lot of people are like, well, you don't take my insurance, I don't want to go. And I feel like it's such a great conversation to have with people. It's because people don't think about it like that. They don't think about like, to me, like prevention is so key. So the less if I don't have to drill on a tooth, I don't want to. I really want you to never have to have a filling. That's really my goal, right? Is to really get you to a place to where you're stable and you don't have disease in your mouth. And we've treated upstream, we've treated that root cause.
And then the prevention is key for us. The thing is what Dr. Taylor was saying, we now have some products that are going to help remineralize tooth structure without drilling. But that's if you start early. When the cavity is small, then we can remineralize that. But when the cavity has been already to that second layer to the dentin, it's a little bit difficult to remineralize. So being proactive and starting early, it's better than just waiting to do treatment. And then the other thing that we see a lot is that the patients that come and they apparently don't have any pain or any discomfort, but when we take a CT scan, we can see a lot of things in there. And that's one of the things that the majority of conventional dentists don't do. They don't use a CBCT or a CT scan. So they're not able to see what's going on underneath those teeth. Because when you see the images, the regular x-rays are hiding things that are not allowing us to see very well what's going on. And that's why we recommend every single patient, every new patient in our office gets a CBCT. It's the only way to evaluate everything correctly.
Yeah, I can't tell you the amount of patients that come in and say, oh my gosh, what do you mean I have a huge infection in my head? Like, I've been to so many dentists and nobody's ever told me that before. And it's very, it's hard because, a lot of the times we are the ones that are breaking this bad news to people, right? And again, like Dr. Isabel said, if we could have caught this when it was a smaller issue, then it's so much easier and it has way less burden on your total body health. So yeah, in our office, we are big fans of taking 3D x-rays because we just cannot do full diagnostics and be thorough if we don't have those. And a 3D x-ray shows a lot of other things besides the teeth too. It shows the sinuses, which again, we kind of talked about the microbiome being not just the gut, but the mouth and the sinuses too, right? So if we see issues in the sinus, we know something is a little off there. It also shows the airway. And so a lot of people these days have snoring, they have sleep apnea. A lot of people are very like undiagnosed with sleep apnea. And those having sleep apnea, even if it's mild, can be linked with heart disease and diabetes risk and even cancers. And so the CT scan, the 3D x-ray really helps us identify other things besides the teeth. We can even see a lot of people come back with calcification in the pineal gland. And the pineal gland is a gland in our head that makes our melatonin. And so when we see calcification in the pineal gland, we have to ask about sleep. Are you sleeping? How are you sleeping? And there's different protocols that functional medicine doctors have to uncalcify that pineal gland. But these are things like your dentist is not going to be talking to you about these things, right? If you go to a dentist that's not a biological dentist, I even have doctors that call me up and go, the pineal gland is calcified, and what do you want me to do about it? And I'm like, you're the doctor. I don't know. You should know this. So anyways, but yeah, we're very, very thorough, and we like our diagnostic data. So
And I want to welcome Dr. Carol. She is here with us. She was
we have
trying to
70, we have over 70 years of dental knowledge in this meeting right now. Isn't that cool?
yes,
Pretty
you'll have to
Thank you.
yeah.
You guys know so much. You guys are so good with everything of all your knowledge. It's like you just don't need me on this thing, but I'm happy to be here. So
Yeah.
Thank you.
So Dr. Carol in
another
our
thing I wanted to make one comment about insurance, and that is the insurance companies require x-rays sometimes to pay for a procedure, and that is not okay. We want to take x-rays when we have to take them, but we don't want to take them just to satisfy insurance companies. And so that's one thing I like about being independent from insurance companies.
Sure. So Dr. Carroll does what's really cool about our practice is that we all do kind of different things. We have 3 doctors, lots of experience here, and we all kind of have our own expertise. So Dr. Isabel does a lot of the surgeries. She takes care of, infected teeth. She does all of that and implants, and is very good at that. She also does some fillings and restorative treatment. Dr. Carroll does high cosmetic stuff. So if you have a lot of wear in your teeth or cracking in your teeth or whatever, it's like, if we're going to do dentistry, we may as well make it pretty. There's such an art to dentistry. Teeth are not just one shade of white. And she's taken countless hours of education and learning how to mimic that biology to make your tooth look really good. Because if you're going to pay for dentistry and you're going to be in the chair and you're going to go through the whole process, at the end, we want it to be real pretty for you, right? Why not?
Yeah.
And then my expertise is more in the bite, jaw, so TMJ issues. A lot of people have bite issues and they don't even know that their symptoms are from their bite. So headaches, migraine headaches, any kind of jaw pain, facial pain, tension in the throat, tinnitus, all of those things can be linked back to bite and jaw issues. And so that's kind of my expertise. I also treat a lot of patients with snoring and sleep apnea. And we have a really cool machine here that can show us, if we open up the jaw and we move the jaw around, what happens to the airway. So sometimes the airway is collapsed because our jaws didn't grow properly when we were kids, or maybe we had braces and they put our teeth in a certain position, or maybe genetics are playing a role as well. And so I work with a lot of patients that have airway issues, and then kids. I love prevention, so I love working with kids and helping prevent them from having those bite issues, because I had braces twice, and I don't want kids to have braces twice. It's like, let's do it the first time and just do it right. So I'm really passionate about that, and it's just amazing as we learn more and more. All of these things that we do in dentistry are so connected with the rest of the body. Whether it's heart disease or Alzheimer's, or it's your posture, your neck pain, your back pain, all of those things we can link them all back to the mouth. So it's very fun to be part of a team where we all have our own expertise. And if you become a patient here, we're going to kind of funnel you to the doctor that you need to see first. And then, once we're done with that, you might get funneled to another one of us, depending on what your needs are. But I really do love our office, because we get to just really focus on the things that we love to do and what we're really good at, because there's so much in dentistry. There's so many different topics, and it's impossible to be a master of them all. So,
And it's great that people need to know that if they have a systemic condition, it can be linked to the mouth. And one of the biggest ones that people don't really connect with is the kids with attention deficit disorders. So a lot of this, and Dr. Taylor, she can talk about her experience with cases like she has treated of kids that they started with attention deficit disorders, and after treated, they change completely because they're either lacking oxygen in their body, because they're not resting, their nervous system is not balanced. So there's a lot of complications, and that's just one example of many.
Mhm.
We can detect, I had a patient and her gums were not improving, a lot of inflammation, a lot of bleeding, and she was coming to the regular cleanings. But then I asked her, have you had your blood work done? Have you checked? Maybe ask your doctor, is there a possibility of diabetes? And sure enough, she was having some diabetes. So her healing was not okay. So it was delayed. So, and then we find a lot of things. Hormonal changes can be seen in the mouth. A lot of the digestive issues can be seen in the mouth. So there's a lot of information that we can get just by looking in the mouth. The tongue has a lot of information for us.
I could do a whole 1 hour talk just about the tongue. You guys would be so bored or fascinated. I don't know. But does
Or
anybody
grossed out.
yeah, or grossed out. I don't know. I never thought I would be talking so much about the tongue being a dentist, but you know, it was just kind of more of an annoyance in dental school, like, oh, this tongue is in the way, like, get this out of here. But no, we talk a lot about the tongue at Green State Dental. Does anybody have any other topics or questions that they want us to specifically address or go over tonight? It's a great question. There are a couple of answers to that question. And Isabel, you can chime in if you want, but teeth get infections for a couple of reasons. One is trauma. Okay. Trauma can come in the form of you get punched in the face. Okay. And what happens is or it can be you're clenching and grinding really hard on your teeth. But basically, there's a blood supply that comes into your tooth. Okay. And there's a little ligament around that tooth that's like a little shock absorber. Okay. So every time you bite down, that little shock absorber does this. Okay. Now, if you get punched in the face and that shock absorber gets really compressed, that can actually cut off the blood supply from your tooth. Okay. And the blood that's coming in is bringing in stem cells and nutrients and all of these things that the tooth needs to be alive and well. Okay. If you're doing a lot of heavy clenching or grinding, that's also a form of trauma. Okay. We can put a ton of pressure on our teeth at nighttime when we're asleep, and we like way more pressure than we can during the day. If I told you to bite down as hard as you possibly could, you can put down like triple the amount of pressure on your teeth at nighttime. Okay. So if you're clenching a lot, that can also cause your teeth to die. Okay. So trauma, that's that category. The other category is going to be decay. So if you get cavity and it gets close to the nerve of the tooth, then that cavity bacteria will get inside of that nerve, and that can also cause the nerve to die. And that will eventually kill all of that tissue down to the bottom of the tooth and create an infection. Okay. The other thing that can create, this goes kind of back to the trauma, the other thing that can also cause a tooth to become infected is a dental drill. So the vibration from a dental drill and the just that tooth going through that traumatic procedure, especially if that tooth has already had some clenching or maybe has had a cavity, that alone can also cause a tooth to become dead and infected. And Isabel, you probably have some other things to put in with the motion code that you do. But in terms from the dental world, that's the perspective.
So the thing is, a lot of it is connected with the fact that the teeth are not just smooth like a wall, right? They are more like they're porous, like they're the dentinal tubules. If you do a section on a tooth, they're gonna look like a sponge more than a plain hard wall, right? So when we have bacteria, even if they do a filling, if there is a cavity, and that they remove whatever they were able to see, we don't have a microscope, and then we think everything is clear, everything is good, but bacteria is microscopic, and there is a possibility that there is some bacteria, some remnant bacteria on the tubules of that tooth. And that's one of the main reasons why we use, one of the reasons, because there are many, why we use ozone. And I love ozone because it helps us with sensitivity, helps us, it's antibacterial, antiviral, antifungal. It has so many functions. And that's one of the reasons, because if there is bacteria in that dentinal tubule, that can go and start creating problems in the nerve. So Dr. Taylor mentioned trauma being one of them, and a fracture or a crack on a tooth, it's one of those, right? And that's the same thing. Bacteria can travel through the dental tubules or to this crack and get to the pulp or the nerve of the tooth, and then start having the pulp, it starts having, or the nerve starts having inflammation. And then if we don't do something, because a lot of the times when we have deep fillings and we use, for example, ozone, we can inject some ozone. And I've had patients that after a deep filling, they complain about having sensitivity, there is some discomfort. And then you can adjust the bite if it's traumatic, if the problem is trauma. But a lot of times I do inject some ozone and the symptoms disappear and the tooth responds perfectly fine. Even a few months later, the nerve it's okay. So it was basically inflammation. But if we don't treat that, and that's why we recommend prevention, we want to be proactive instead of waiting. Because if we do things at the beginning, we can treat them and we can have better results. And if we are going to think about that emotional aspect, I will encourage you to look at the correlation between the meridians and the connection with the teeth, because that can give you some information about what it is that can be happening. But when there is an abscess, it depends on where the tooth is positioned. It can get more deeper information of that emotional connection that you're having with that specific tooth. It's powerful because I'm seeing patients, new patients come to my office and I tell them something without even touching them and they start crying because there is a huge emotional connection with what's going on in the mouth. And when we start kind of researching, okay, what is it that this tooth specifically is trying to communicate to me? And it's really, really, it correlates with what's going on in our lives. Our body is wise and is always giving us signs that there is something at a psycho-emotional level that needs to be addressed. So it's fascinating. I will encourage everybody to start looking at their teeth and say, okay, what is the meaning of this? What is it that my body's trying to communicate?
And if you want to go even deeper, I mean, that was pretty woo-woo, Dr. Isabel, but it's true. But if you want to go even deeper, we talked about cavities and bacteria, right? So why are those bacteria in your mouth in the first place? And why are they thriving, right? So, our teeth are really smart. They're little organs. They're self-cleaning. They clean themselves, and so the liquid inside of our tooth really, the pressure pushes the liquid out of the tooth and that clears all of the bacteria out. But when that system doesn't work anymore, the bacteria can get in and get sucked into the tooth and cause an issue. And so this is, again, where we kind of have to go back to that systemic picture and say, okay, what is going on with this person? What is going on with this host? Why is the bacteria winning? Why are they winning, right? Because our teeth are made to clean themselves. If you get a little bit of cavity bacteria and you get a tiny little spot on your tooth, your tooth should be able to heal itself, right? If you give it the right things, if you give your body the right things, it should be able to heal. And so we have to kind of zoom out and say, all right, the bacteria is winning. And why is that happening? And like I said, a lot of this links back to the gut. A lot of it goes back to leaky gut. A lot of people have leaky gut. And so a lot of our patients will get on actually a gut restoration protocol. When we see cavities or we see infection, that almost immediately tells us, especially if the infection is from a cavity and not trauma, if it's truly from a cavity or bacteria, then we are thinking we got to fix this gut. We got to clean this gut up. And there's some really, really cool, powerful supplements and different probiotics and different things that we can give patients that can really help change that microbiome. We actually see in just 3 months of doing this gut protocol that we don't have to touch the mouth. You don't have to change your toothpaste. You don't have to change how you're brushing. You don't have to do any special mouth rinse. But if we take a saliva sample 3 months after you've been taking our gut protocol, we see changes in the mouth microbiome. And that's all we do. And so it's really amazing how connected those things are. And I think a lot of us dentists are just so hyper focused on locally in the mouth. You know, I need to put this medicine on this tooth and I got to put this fluoride on there and that'll help patch that up, right? Or I got to get in there and drill and I got to put my little filling on and it looks pretty now, right? But we're obsessed with the bacteria in the mouth, but we never ask ourselves, well, why? How did it get there in the first place? And how do we change it? Right? So a lot of people, your microbiome is kind of set, but you can change it. And but you have to know how to. So we love doing that with patients. It's very fun because a lot of times when you start cleaning up your gut, a lot of other health issues start to go away for you too. So we've had patients that have had high blood pressure and they're on medications and they come back and they
migraines are gone.
Yep, migraines are huge. I treat a lot of patients with migraines. And we see that when we clear up that gut and we get that functioning again, you have to remember, like, the serotonin is made in our gut. Melatonin, a lot of it is made in our gut. We have 80% of our immune system lives in our gut. So if our gut is not working properly, then all of these systems, your immune system is going to be down. You might not be sleeping super well. You may not be able to absorb certain nutrients. So you might be eating this super healthy diet and taking all of these amazing, expensive, wonderful supplements, but you're not able to get them into the body because your gut's not working the right way. So when we can clear the gut up and we can fix that, we see all sorts of things that start to improve. And a lot of inflammation, people, they heal faster, they are more energetic, they feel better. In fact, some people, they actually they're like, wow, I was on antidepressants, but I don't think I need them anymore because of my, the gut. And again, we're dentists, so we don't treat depression in our office, but it's all connected together, right? And so I think that's something that we at Green City Dental, we're very educated in these things. And so, we're never going to tell you that we're going to cure your blood pressure or whatever. But there is always side effects, right? And when we clear up and we fix the microbiome, we see other great things that happen in the rest of the body. And my husband is a perfect example of this. So I met him when he was 40. He had high blood pressure when he was 15. And his mom died when he was 6, just dropped dead from a heart thing. And he went to so many specialists to try to figure out why he had high blood pressure. Nobody could figure it out. His brother is a doctor. He comes from a very educated family and they couldn't figure it out. So they told him, we don't know why you have high blood pressure, but here is some medication. You're going to just have to take it for life. He's a teenager when he's on this. Okay. So I met him on our first date and he's telling me that he's on this blood pressure medication. And I look at him and he's fit. He doesn't have any other health issues. Like, he's very healthy, right? But he's not healthy because he has high blood pressure. And I'm like, okay, did anybody figure out why you have that? He's like, no, they couldn't figure it out. They just told me that I had it. And I'm like, well, that is weird. I also noticed that he had this little patch of red skin right here on his cheek. And I was like, what's that patch of red skin? Oh, I've had this since I was a kid. My brother has it. My dad had it. My other brother has it. I just have to live with it. And I'm like, interesting. I was like, I think you have a dairy sensitivity. Have you ever tried cutting dairy out of your diet? And he's like, no. I'm like, you should try it. And it was our first date, right? He was like, okay, this girl's crazy. And I was like, let me look in your mouth. And so he showed me, and he had a crossbite and he had a high palate. And I was like, do you snore? He's like, yeah, my ex told me I snore, like not really bad, but I definitely snore. And I'm like, I bet you have sleep apnea. So anyways, long story short, we did some testing on his gut. He was a mess. He had a crazy dairy sensitivity, so inflammatory. He didn't tell me this on our first date, but he had IBS. He would pass out on the toilet, and that happened to him twice, and he had to be taken to the hospital. They told him, we don't know, you're just going to have to, eat less rich foods, and eat slower. Eat slower. So that's what we did. And after our dates, he would go home and be on the couch, and he would just be like in so much pain. So anyways, it took him about 3 times cutting dairy out of his diet and then feeling like he wanted to die for him to realize that he was really sensitive to dairy and gluten. So he cut those out of his diet. His skin rash completely went away. He came in for a hygiene visit, and his blood pressure was 108/60. And the hygienist was like, oh my gosh, you should probably go talk to your doctor about your blood pressure medications because you have low blood pressure now. We fixed his snoring. I did Knightley's procedure on him, which is a procedure that tightens your soft palate and it helps open up the airway. So we improved his airway, and he today, nope. Like, we had our physical done, and we now compete for the blood pressure reading of the lowest one. He has no more blood pressure issues, and his rash is gone. He has no more IBS. And the thing that I'm so annoyed with is, like, how come a dentist had to figure this out for you? A dentist had to I had to figure this out. And this is what I was saying in the beginning. Like, it's so important that you all are your own health advocates, right? Because the doctors don't always give you the answers. They don't know. They only know what they're taught, and they're not asking themselves why and putting these pieces together, right?
Yeah.
So it's so powerful to be just to keep pushing, right? You have to keep pushing to figure these things out. And even with my husband, like I said, he had to cut dairy out 3 times and do elimination diets. And I would be like, you're definitely like, okay, this is off topic a little bit, but we were sitting at a restaurant, and he hadn't eaten gluten for 3 weeks, and he was bit into a sandwich, and he's like, see, I'm not sensitive to gluten. He is just farting in front of me at the restaurant. And I'm like, what are you even talking about? Do you hear what's happening? Like, do you hear you? So he had to do that 3 times and see that correlation for him to get like, oh, he's Italian. So the cheese and the gluten are just like, it's very emotional for him, right? But man, I'm like, you got to cut that crap out of your diet. You can't handle it. Your body can't handle it. It causes so much inflammation in your body. I can handle it. I can eat gluten. I can eat dairy. I can eat all of that. I don't have the inflammation that he has. But for him specifically, that was his problem.
Yes. So we have a question here.
Yes.
I love that story.
Sorry, I'm like
No,
talking
that's good. I love it.
going on tangents, but
it says, I have 3 teeth that I'm supposed to have crowns done for. Can you address crowns? Are there other options, or is it too late if you have been told you need crowns?
oh, Dr. Carrol should take this one.
Yes, go for it.
Thank you. By the way, I want to go back about your emotional link, Dr. Perez, because the medical doctor, Bruce Lipton, did a lot of research on emotional links to overall health. And so if anyone wants to go down that rabbit hole deeper, that would be a great resource for them. What happens with crowns is, what we're starting to understand is, if we can leave enamel left on the tooth, we have a better chance of protecting that tooth with better bond strength. So what we're doing is we're bonding everything in place now. And because we're bonding, we don't need to do a full crown. So crown traditionally was removing all the enamel on a tooth. We removed all the enamel and we cemented the crown on top of what was left over. And now the new dentistry is really focusing on preservation of enamel and doing what we call onlays. And onlays, it's hard to describe this on a conversation like this, but onlays are designed in particular to what your particular needs are. So the designs can be just a variety of different designs. And we really are focusing on trying to leave as much enamel on the tooth as we possibly can for several reasons. We get better, stronger bond strength when we've got more enamel to our porcelain. If for some reason down the road you ever have to have this redone, the dentist that's treating this onlay or treating this tooth has a lot more tooth structure to work with. And then the third thing is that when you're in a hygiene room or we're brushing, flossing, or whatever, we can actually see how this onlay is aging. Is it aging very, very well? Does it have good bond strength, or is there some kind of breakdown that's happening on that? We see that far sooner than we would ever see on a crown. And there's a lot of people that'll tell you that by the time the dentist or hygienist found decay underneath the crown, it was just a big problem. With onlays, we have a better opportunity to evaluate them at an early stage. And what's really neat about that is that if for some reason there is a debonding happening on an onlay, in a lot of cases, we can just simply repair that area. We don't have to replace it with a whole new onlay. So I love the conservation of the new bonding strengths that we're doing now. We're just really trying to not remove tooth structure unless we absolutely have to.
Going to reduce your root canal risk too, right? Because going back to that question about trauma, right? So a dental drill causing trauma to a nerve of a tooth. So if we can preserve tooth structure and drill less and traumatize that tooth less, then you're going to be less likely to need a root canal treated tooth, which is a win. So we love preserving as much as we can. But another thing is that if you have already had a crown, like if you already have a crown and they're saying, okay, this crown has a cavity, you need it to be replaced, you've already lost the enamel and the tooth structure, so we have to replace it with a crown. But if you have a tooth that has a big filling or it's got a fracture or something in it, then we're always going to be wanting to do an onlay or a more conservative type of crown versus a full coverage crown. So does that answer your question?
So sometimes, just depending on what's going on with the tooth, then we'll have different options. But as Dr. Taylor and Dr. Carrol mentioned, we want to try to minimize the amount of tooth structure that we're going to remove. So we want to just treat whatever needs to be treated, like if it's a decay or if it's a fracture, depending on what it is. And then, so either do a more conservative treatment, which it would be a biomimetic composite, for example, which is going to leave good amount of tooth structure. But if the problem is bigger, we'll go to the next option, which it would be an inlay or an onlay, which it will cover part of the tooth, but will leave the remaining good tooth structure. So they say that the cavities are too big to be filled, and so they need a crown. One is also to replace the silver filling.
Ooh, I would definitely get a second opinion on that. If you're just getting fillings replaced, like Dr. Carrol said, we rarely need to do a crown on those teeth. Even if half of your tooth cracks off, we're not doing crowns. So I would get a second opinion on that and make sure you're seeing a dentist that does biomimetic dentistry, because the type of fillings and the materials and the techniques and all of that, they're not created equal. What we learned in dental school and what the current technology is different. So you really want to make sure that you're going to a dentist that's really up to speed with very minimally invasive, very strong, biomimetic dentistry. So yeah, but going back to that insurance stuff, the insurance companies will pay for that. But they might not pay for an inlay, right? Or an onlay. So, yeah.
Yeah, and it's
Well,
always very good.
not only that, but the new technology now is to really be careful with getting close to the nerve chamber. And Dr. Perez talked about the ozone. Ozone kills bacteria, viruses, and fungus on contact. And so the new technology now is to really try to stay away from that nerve chamber as much as you can. And in this office, we couple that with ozone. And the whole idea is to not disrupt the nerve chamber. And if we can keep that nerve chamber from getting too upset, we can prevent we can prevent a root canal treatment from being done. So the new stuff is really trying to treat that bacteria that's very close to the nerve chamber in a way that actually prevents you from needing a root canal treatment.
Yeah. And remember, silver fillings, which are 50% by weight mercury, so they really should be called mercury fillings, but they expand when they're placed. And so the only thing that's holding them inside of your tooth is the pressure from the filling, from the expansion that happens within 24 hours of having your filling placed. There's no glue. So what happens is, because that material is so strong and it's pushing on the enamel, what happens is that creates cracks in the enamel. And so a lot of times when we take mercury fillings out, we see these cracks underneath. 80% of the time, we're going to see these big, obvious cracks in the teeth. Okay. And so the biomimetic approach to repairing that tooth is, how do we make that tooth as strong as it was when it had no filling in it at all, right? And that's what biomimetic dentistry is about. It's about building that tooth, and there's a very specific way, very certain materials. You have to do it in a very, very specific way to be able to get that tooth to be stronger. And a lot of dentists aren't trained that way. And so the only thing that they know how to do is a crown, right? But that over time is more aggressive. It puts you at a high risk for a root canal. And like I said, over time, crowns have to be replaced, especially if there's other stuff, going on. And the less we have to drill on a tooth, the better. So we want to be as minimal as we can. And we really want to make sure that that tooth is being built in a certain way so that it can hold its strength.
Yes. And then one last thing before we finish this, because I want to be considerate of everybody's time, is to make sure that when they're doing the silver filling or mercury filling removal, is that they're doing it safely. And that's one of the most important things that we do at our office. We use the SMART protocol, which is safely removing this mercury fillings, because they do release vapors. So you don't want to be inhaling that, and you don't want that to be going to your system. You've been swallowing multiple times a day this mercury already in your body. There's probably some mercury in your body that it will be a good idea to do some detoxing and go and talk to a functional medicine doctor or naturopath to be able to address that. But then removing the silver fillings the proper way will be the best for you.
Yeah, when we are drilling on those silver fillings, there is an enormous amount of mercury vapor that's released into the air, and you're breathing it in, and I'm breathing it in, and the assistant's breathing it in. It's all in the air. And we know that the mercury gas, it doesn't have a smell, but it goes straight through the lungs, and 80% of it gets right into the bloodstream, and it converts forms. And we talk so much about how fish have so much mercury and we shouldn't be eating tuna, and if you're pregnant, don't eat tuna, but we don't really talk much about these fillings that are in your mouth that are definitely off-gassing. And so if you have mercury fillings and you're getting them removed, make sure that you are protecting yourself and going to a dentist that is going to remove them safely, because I've seen a lot of patients that come into my office very, very sick after they've had their mercury fillings removed. And we know from studies in sheep that just after 30 days of having mercury fillings in your mouth, they did a study where they sacrificed sheep after 30 days, and they found that the mercury accumulated in every single organ in the sheep's body. They said, well, sheep are not humans. That's a bad study. They did it in monkeys. Same results. So that's just 30 days. So if you've had mercury fillings in your mouth for many, many years, you know, and all our genetics and our detox pathways are different, but there's a high likelihood that you may have heavy metal toxicity issues. And that metal toxicity is going to cause excess inflammation in the body. And it's great to work with the functional medicine doctor, even before you have those fillings out to prep, and then afterwards to really do a very thorough detox, because removing it is the easy part. It's super easy. You sit in our chair in a couple minutes, it's out of your head. But what has that done to your body over time? We don't know. So getting in with a functional medicine doctor to do more testing and detox is highly recommended.
Well, thank you, everybody. Thank you for joining us.
You.
And we want to just invite you to stay tuned, because we will try to do this every month, and just send us your questions. So if you're not able to join us, then we can answer those questions.
Yes, and the other thing that I wanted to mention is that we do have a podcast, and we have over 50 hours recorded on our podcast of all different topics related to dentistry, biological dentistry, and systemic health. So if there is a specific topic that you want to learn more about, like if you are interested in gum disease or cavities or crowns or biomimetic, you want to learn more about that biomimetic dentistry we were talking about, we have podcasts on all of those things. So the podcast is called Your Mouth Matters, and you can find it on any platform that does podcasts, and our website, greencitydental.com. I have personally written many articles also on all of these topics. So if you are more of a read visual learner, then you have that resource. And if you're more auditory and you like listening to podcasts in your car, then our podcast is a really great resource for patients.
Bye.
Thank you, everyone.